Acute lymphoblastic leukemia, or ALL, is a cancer often seen in children under the age of 10. It begins in the lymphocytes of the body, which are a specific type of white blood cell. Lymphocytes make up 25 to 33% of the entire white blood cell count in the body. These cells have multiple functions. They produce antibodies against foreign particles. They rid the body of invading and dangerous particles, and they also fight infections. The three main types of lymphocytes are T cells, B cells, and natural killer cells. ALL is commonly linked to a genetic translocation called the Philadelphia chromosome. The DNA is swapped between the chromosomes 9 and 22, or 12 and 21. Oncologist researchers believe that the genetic abnormality often occurs during fetal development. The protein produced from the fused genes causes lymphocytes to divide abnormally and prevents the tumor cells from repairing the DNA damage. Studying the Philadelphia chromosome can help predict how a cancer will progress and give a target for molecular therapy. When one is diagnosed with ALL, the most common form of treatment is chemotherapy. The risks of chemotherapy includes a long list of side effects. Common side effects include anxiety, indigestion, fatigue, and weakness. Chemotherapy drugs can also lead to even worse conditions besides just temporary side effects. Some serious side effects of chemotherapy and ALL treatment is an increased risk of getting acute myelogenous leukemia at a later time in life. These side effects are seen in those who are given the drug doxorubicin, an anti-neoplastic antibiotic. It works to kill cancer cells. Patients can also develop tumor lysis syndrome from the drug imatinib, a protein inhibitor. The drug is administered to prevent the growth of cancer cells. It is seen in patients who have had a large number of leukemia cells. When the cells are destroyed with the drugs, they break and release their contents into the bloodstream. The kidneys are overwhelmed as they cannot get rid of all the substances at once. Excess minerals can affect the heart and the brain. Another treatment for ALL is a bone marrow transfer. Only specific people can have a marrow transfer, depending on which chromosomes have translocated. A patient must have specific characteristics to have a bone marrow transplant. Those with a Philadelphia chromosome or a translocation between the chromosomes 4 and 11 should have this procedure. There are many risks of stem cell transplantations. One complication of this procedure can result in a graft versus host disease. This occurs when cells in the transplant tissues do not recognize the patient's cell and they try to attack them. The patient's immune system is also weakened when they get this transplant. Radiation is also a possibility for treating ALL, but the least commonly used of the three. In most cancer treatments today, the radiation therapy is just as toxic to the body as it is to cancer cells and tumors. These current treatments are considered unethical because they can lead to an extremely low quality of life. The effects of chemotherapy can be very hard on young children, who are usually the victims of ALL. Scientists seek these new treatments because of the inefficiency of current cancer treatments and their serious side effects. With nanotechnology, medicine is turning to physics for new and innovative treatments. Nanotechnology is the manipulation of matter on the atomic scale and can be applied to many different avenues of science. Nanorobotics is the emerging field of creating microscopic robots or devices. They are smaller than the human cell, which is 10,000 to 20,000 nanometers in diameter. Nanotechnology can serve as an alternative to improve early diagnosis, imaging tools, and even targeted drug delivery. Quantum dots can be attached to antibodies for cancer biomarkers to allow for oncologists to distinguish between cancerous and healthy cells based on their light signals and colors. For the treatment of cancer itself, nanoshells are being developed to thermally destroy tumors from the inside. They can absorb light of different frequencies to generate heat and selectively destroy tumor cells without disturbing neighboring healthy cells. With such a new technology, the benefits and potential applications of nanotechnology are the same as what makes them toxic. Nanoparticles behave dramatically different from the larger particles of the same material, making the interaction between organisms and nanoparticles uncertain. Scientists are particularly uneasy of applying nanotechnology to medicine because little data exists of how nanoparticles might interfere with biological processes, and the idea of delving into such an uncertain field is troubling. Nanoparticles are potentially dangerous because they already have been linked to lung and genetic damage. Nanosystems Biology Cancer Center has developed a series of positron emission tomography imaging agents. These agents at the moment are being tested and used to treat different cancers, including leukemia. The Center of Nanotechnology for Treatment, Understanding, and Monitoring of Cancer has also developed an adenovirus nanoparticle. This will be able to deliver molecules to stimulate the immune system. This technology is being tested on patients with leukemia currently. Nanotechnology is an up-and-coming treatment for cancer, but there is no specific treatments for acute lymphoblastic leukemia. Many nanoparticles have been designed that target different types of cancers and deliver drugs effectively to certain tumors, but there is no complete treatment to rid a person of acute lymphoblastic leukemia. Our recommendation to the PA Medical School Board for the course of treatment for ALL is using known and safe, reliable methods like marrow transfer, drug administration, and chemotherapy. Before considering using nanotechnology to treat a cancer, a patient should be treated with chemotherapy. Some patients do not respond to these traditional treatments, and their cancer progresses throughout the body to the point where survival is infeasible. Others are not genetically capable to respond to bone marrow transfers. In this case, nanotechnology provides an alternative for those who are not fit for the traditional treatments. The patient should be ready to accept the chance of not surviving and be unbiasedly informed of the information so they can have an informed decision on whether or not to follow through with nanoscience trials.